Thank you.
Yeah, because
there's some people waiting in the lobby, Ed.
Yeah, I've admitted them. Sorry, slow
Thank
computer. I can see your screen as well.
Great. So just a repetition of the rules here. So make sure, please, you're muted. You can use the chat functions to put your questions as we go on in the presentations, giving the presentations. And you could, at the time of the discussion, you can raise your hand up. And as Ed said, we are recording this session, so for wider distribution. In this session, we will have two-part presentation. Myself, I will talk about the vomiting and diarrhea and outbreak management, and Maria will follow up with a case study so we can just have a sense of what we are basically trying, the message that we are trying to share with you. During this session, I will talk to you about diarrhea and vomiting causes, and I will focus on the duty of care from a setting to planning time and at an outbreak time. And I will also talk about what is outbreak of diarrhea and vomiting, and then cover infection control measures. And I will focus pretty much on cleaning of a spillage. So diarrhea and or vomiting, we refer them to as DNV, can be caused by infectious and non-infectious diseases. However, our approach is to consider all vomiting and diarrhea or gastroenteritis as infectious unless there is evidence of otherwise. For example, lead poisoning in children can cause black diarrhea, for example, but we will treat any diarrhea as infectious until we have evidence otherwise. A norovirus, or what we can call the winter vomiting or the stomach flu, is probably the most common cause of vomiting and diarrhea and causing outbreaks in the UK. So I will focus most of my presentation on norovirus. A group, norovirus is group of viruses, has many strains, as like in flu, it has a lot of strains, almost 25 or more. It's extremely contagious, so it is spread between people very quickly, and whether from person to person or by the virus settling on surfaces like the doors, the toilets, the toys, any material that the aerosols coming from, whether from person or the feces, is going to cause to be a source of infection. The virus can survive on surfaces for almost 2 weeks, and the excretion in feces begins a few hours before onset of symptoms and can continue up to 7 to 10 days. But the maximum time of the person shedding can occur for the first 2 or 3 days after they have been exposed. An individual has to be for this away from a setting for 48 hours free of vomiting and diarrhea before they can come back. Just want, because I think I'm COVID turned on. I said aerosols earlier. That doesn't happen. The infection is coming mainly from the feces. The body excrete the virus in feces, and that's how it's spread between people. And also want to talk about another cause of gastroenteritis that we do not wish that it is mixed up with norovirus, because it is way more serious. It affects young children mostly, and can be very serious illness, can kill the children. This is what we call Escherichia coli. I'm sure you have heard of, most of you would have heard about it. It is what we call it E. coli 0157. And there is other strains now that are similarly dangerous, but the most common one is what we call an 0157. About 5 to 10% of people with STEC, that's the abbreviation of the E. coli. It's called Shigella toxin excreting E. coli. So this bacteria that excrete this toxin that is very potentially life-threatening. And the most can you listen to me right? Because I hear some noise in the background.
Yeah, you're fine now. Somebody was unmuted, but it's good. Carry on.
Sometimes I think it's me. And the most common complication for STEC is what we call the hemolytic uremic syndrome. We call it HUS. I think you will hear sometimes about HUS in the news. Unfortunately, and you know, it happened in settings like early year settings or care homes. It causes mainly diarrhea, but often this bloody the diarrhea will be bloody, and it can be accompanied of vomiting. So some children will not vomit. Most likely, it will lead to hospital admission, and the children which shed this bacteria for a long time. It could be up to 5 to 6 weeks in some cases. And for this reason, we do tend to pot the cases and contacts, that means that we take samples and to make sure that they stopped shedding before we allow them back into the setting. So basically, these are the two, norovirus and STEC are the most possible causes of gastroenteritis in early settings. I would like here to speak about duty of care. Norovirus is most common during the winter, as we know, and for this reason, we expect early settings to have some planning in place, what could be collectively called an outbreak plan. So we do expect a head teacher or manager in these settings to be responsible to ensure first they followed their planning checklist for norovirus season. And I would like just to go very quickly through it. So I just make sure that you are aware of it. So it looks like this, excuse me, planning checklist for norovirus. Excuse me, just a second. And it covers infection control measures. It makes sure that you know, all staff are aware what are the procedures to, for example, isolate the children if they became very unwell, so they have a place where they can isolate the child until if he became symptomatic, and until their parents come in and see them. Make sure that there is personal protective equipment if required. So there is a set of these planning that we expect the manager or a head teacher in a setting to follow it every time before the season starts. So and I'm not going to go through all of it. It just covers the infection control precautions, covers ensuring that you report to the health protection team, and then there is some control measures. So more or less, I will cover these as I go along in my presentation. So you would also make sure that as a duty of care that there is comprehensive planning contract with it could be resourced out that include daily, weekly, and periodic cleaning schedules based on the national guidance. Ed would be able to send you the guidance that we put together for you. As I mentioned earlier, it's very important that the staff are all aware of the planning and make sure that they understand what is IPC measures and understand the importance of hygiene and enhanced cleaning and the prompt exclusion of cases. And the most important thing, as I mentioned, is the spillage kit. I'm not sure everywhere is called a spillage kit, but ensure that there is adequate supplies of equipment that a staff member who is trained to use is available, is in a place that known to everyone, and it's away from the children. And I will come into details for this. So this is just the planning checklist. I'm putting it here. What are the 3 main areas that it covers? So another duty of care is during an outbreak. So we expect the setting to immediately, promptly notify the health protection team in UK Health Security Agency and the local authority. And we expect also a high standard of record keeping. And by this, I mean that you will have a table put together where a child who is a case, the name is put there and the time they left the school or the nursery, and counting the 48 hours rule to make sure that what date they would be able to come back. This is extremely essential because parents tend to send their children once the diarrhea has stopped. So the school would have this responsibility upon them to make sure that the date of a child coming back is really monitored. In terms also communication, once there is an outbreak and when the setting calls the HPT, there would be a dialogue between them, risk assessment will be carried out, and then the school should communicate that there is a situation of an outbreak and ensure that all staff, parents, and if there is any visitors, whether visitors to we hope that any visitors will be stopped if declared an outbreak has been declared. But if this happened anyway, so you would be responsible to make sure that everyone is aware of the outbreak. Then the process of the cleaning and disinfection that I will come to mention in detail should also be followed as planned, and so we could after all the control measures has been applied, we could also agree with the HPT. You agree with the HPT when is an outbreak is over with a definition. I will also mention this in more detail. When the HPT and the setting agreed that the outbreak is over, also a deep or what we call terminal cleaning should take place. So what is an outbreak? Because I kept saying an outbreak. So any 2 cases or more of vomiting and diarrhea in the setting, or the people could be vomiting and diarrhea. So 2 or more cases, or because the children settings usually have these diarrhea incidents of diarrhea, then you would make a decision that this is more than what you are expecting in normally. So there is some kind of judgment here. If you are not confident enough, you would definitely inform the HPT and an assessment will be done to basically to agree if this is an outbreak. There is important questions just to also decide if this is an outbreak, and just make sure that an outbreak of what gastroenteritis, and make sure that it is not STEC, as I mentioned, because STEC is life-threatening condition. So if there is blood in the stools, that should not something you need to observe. Has anyone, when affected, were admitted to hospital or died as an extreme possibility. Is there any evidence that a symptomatic food handler was involved, or a food source was involved? So we can also differentiate between the possibility of a norovirus or a food poisoning. And there also, was there any event within the school that, or the setting, where the children were taken some for an out of school activity prior to having these cases, because also we want to exclude that it is not something else, like we know that STEC sometimes is associated with children visiting farms. Also, we need to understand what is an end of an outbreak. And as I said, this is something that we would, the HPT would agree with the setting, but by definition, it is 48 hours after the resolution of vomiting and of diarrhea in the last case, known case, or as a general rule after 72 hours from the onset of the last new case, because the cases usually happen so fast and very close to each other, because as I mentioned, it's very contagious. And as you know, this is something need to be assessed and agreed on with the health protection team and to declare it to declare the outbreak over. And after that, as I mentioned earlier, a decision to do the deep cleaning will be made. So infection and prevention control measures, that's what we call IPC. When you call the HPT, we would go through these measures, and usually it's make sure that hand hygiene is enhanced within the setting that you make available. Make sure that warm water and soap is available for children. Very young children are assisted to clean their hands frequently. And also isolation and exclusion. So isolation, if the child became sick at the setting, a secure place and supported, where the child is supported until their parents come and get them. And the exclusion that within the communication process you follow is to tell the parents that your child, if we have an outbreak, if your child became unwell, please do not bring them to school, and that's exclusion. I will focus on cleaning, and basically there is here a government guidance, chapter 6 precisely, which focus on the cleaning during an outbreak. It will also be available to you. We also, just to draw your attention to how management of body fluid spillage guidance. There is a very nice guidance where it takes you in a chart what to do exactly when there is a spillage, and asking you basically to put PPE, and asking if it is soft or if it is blood, and you follow. It's quite easy, and I will just cover most of this, but please be aware it also the link to this guidance will be sent to you. Did I skip link? No. So usually when there an incident or episode of vomiting and diarrhea happens at the setting, you would immediately cordon the spillage off. You clear all children staff from the area, exposed area. A trained staff should put a PPE, and that involves gloves, a mask, and a plastic apron, so to reduce their exposure to the virus, and then to use absorbent material to soak up the visible vomit or the stool. So you just papers basically to absorb all the the fluid out of the deposit. And after that, scrub up the vomit or the stool using a suitable material. It could be something professional, or it could be a hard board. To dispose of this immediately in a plastic trash bag, and then clean the area around it using detergent and disinfectant. So the most important in the cleaning is that you would need to cover an area of 7 meters or 25 feet around the vomit. So if there is any toys, any desks, anything that has been around that, it needs to be also cleaned appropriately. If it is left, that would really be makes the virus available and picked up by anybody who put their hands on these surfaces. You would also, as just mentioned, that the toys is also an issue here mainly, and if it is a soft toy, you also need to follow the algorithm that describe how you could make sure that you clean these items. You would need to make sure that the contaminated area is isolated, so you know what will come near the area for the next 2 hours, because the particles, you know, during the cleaning can just rise and be available in the air, and could be also infectious and lead to an infection. It is recommended that you do not vacuum the area before the cleaning, so don't go around the incident itself and trying to clean it, because that will also result in a rising of these particles and became airborne and spread. Are the personal protective equipment that is recommended to be put on by trained staff before they attempt to clean the incident. So the simple gloves and plastic apron and a mask or goggles, just because if there is any risk of splashing. The staff need to make sure that they wash their hands with soap and water after they have removed the PPE. This is not a recommendation of a specific product, but we would like that basically Ed supported in this, making sure that it's not very difficult to understand what solutions can be using in cleaning and disinfecting. And there is 2 products here that has been found, Milton's, and the instructions very clear. Basically, these are chlorine based solutions, and the instruction is to use a dilution of 1 in 20. So you put a 50 ml of Milton in 1 liter of water, or it could be basically double that and make a bigger amount. Always read the manufacturer guidance in any product that you use. There is also chlorine releasing granules, and these can basically it soaks the fluid part of the spillage and make it safer to clean, and it is chlorine based basically. So my main message for you here is that it is essential, it's very essential that you have an outbreak plan. You prepare for the season. You communicate immediately with the health protection team and the local authority. You make sure that you exclude the children as per the guidance, and very mainly as anything infectious, washing hands. In the last year, 2021, we had 13 gastroenteritis outbreaks in Waltham Forest. 3 of them were associated with cases of STEC. And this is basically quite alarming situation. We know that the 3 situations that were attached to the cases were not known to the health protection team. So there was an outbreak of vomiting and diarrhea, and then by chance there was a child with STEC who was allowed into the school, and we have not basically we only knew about the vomiting and diarrhea outbreak when we tried to investigate the STEC case. So in the next part of this session, Maria will cover basically give a case study of what we had. Please, it is an accumulation of 3 stories, so make sure that you do not think that it was your setting that is mentioned here. Thank you very much.
Thanks, Maha. Maria, you have to, oh, there you go. Are you happy to share your screen, Maria? Is that what you're doing now?
Yeah, just about to. Thanks, Maha, for that. Open.
Excellent.
Can you see the right screen?
Yes.
Yeah.
Brilliant. That's always the tricky part. So I'm Maria. I'm one of the health protection practitioners, and as Maya said, I'm going to do a case study. It's not one school, it's an amalgamation. It's not all from Waltham Forest either. It's from all over northeast central London. So if there's anything that matches your school, it's probably because it happens in other places, which is one of the reasons why we're doing this presentation, because there's quite common features in all of them. And the idea of this isn't just about the case study, but it's so you can understand what would happen if there's an outbreak, what we would do, and some of the kind of red flags we spotted in nurseries. So there's a question in the comments as well about getting presentations, and we will send them out after and with the link, so don't worry about that and speed writing things down. Okay. No, we're not moving forward. Okay, so background. So any NCL, which is us, we were notified about possible E. coli STEC case, which Maha was talking about, in child X, and they're 2 years old. Child X was symptomatic with diarrhea, vomiting, and stomach cramps. When we phoned the mum, we found out that he was attending a nursery, and that nursery had an ongoing outbreak, and she said it's been going on for the last 10 days. We checked our system and couldn't see anything on there. So what happens next, or what we did next, we phoned the nursery and we conducted a risk assessment. So when we phone up, we ask about the number of cases, which was 24 in this scenario. We ask a bit more information about the cases. So who is it? Is it staff? Is it students? We also get a bit of background about the nursery. So how many children do you have? How are they split up? What are their age ranges? What do they share? What don't they share? Because as you guys know, each nursery is a little bit different, and what we want to know is the transmission and if there's any issues. So in this nursery, the onset was on the 9th of the 11th, and the most recent case was the 18th, which is the day that we phoned up, and that's when we got notified about the E. coli. The nature of the symptoms and severity, so we generally ask, what is it, all vomiting, is it all diarrhea? So in this instance, it was diarrhea, vomiting, and stomach cramps, so quite similar to child X. Have they had any samples? You might not know this, parents might not give you this information, but if somebody's gone off with diarrhea and vomiting just before they come back, just ask if they've had any samples done. They don't have to tell you, but it's useful, especially if you've got an outbreak, because we'll want to know what's going on. So if their samples are already taken, we don't need to then organise any more. Hospitalisations, that's a key one. So have you had any people who are very ill or been into hospitals? In this case, no. Any staff involved in food handling, like Maha was talking about, is quite important to know. In this situation, there was 2 classes affected, class 2A, which had 6 pupils, and class 2B. Child X was in class 2B, but initially the outbreak started in class 2A, but 2A and 2B have lunch and breaks times together and share toilets. So that's where the issue lies. That's where the transmission was. It hadn't spread anywhere else at this point. And over the 9 days, it was an increase of cases. So they had 1 or 2. Child X became ill. then 3 and 4, and then a couple of teachers, and it just increased until they had 24 when we called. We then asked a bit about cleaning, so what type of cleaning they were doing, and in this case they were cleaning where the children vomited, washing their hands, cleaning after school, but 2A and 2B classes were still mixing. So some red flags we came from this, but onset, so it's on the 9th, we didn't get any told about it. We found out because we had an E. coli, which meant everything was delayed. So that's already 9 days when measures could have been implemented on day 9 or 10. And it meant we didn't get any samples back until the 22nd. So we didn't know if it was E. coli or not in the nursery, when actually if we'd found out on the 9th or 10th, we could have got samples done on that day and probably results by 13th, 14th. Not correct cleaning procedure. So some of the measures we're using were correct, but it was just cleaning where they'd vomited, not all around and not all over the toilets, and high touch points like you do in COVID, all the high touch points. And it was cleaning after school, not necessarily in between lunch times. Children weren't being kept off till 48 hours symptom free. I know that's really difficult for you guys because you've got to go by the parents, but as soon as they note the symptoms, just say, oh, when did they start feeling unwell, and put that note down and say this is the earliest they can come back. And maybe keep that to yourselves, because parents might be like, oh, I won't tell them they vomited 3 hours, a day later, so they can come back early. There's still a lot of mixing between the classes in this situation. So teachers were teaching in 2A and 2B, which I know is pretty difficult in some cases because it depends how you're set up. So in this instance, so child X had been unwell with diarrhea and vomiting. They'd actually done their 48 hours, come back, went back to the nursery. The nursery still had the ongoing outbreak. Staff and noticed that the child had diarrhea, but mum said that it was just from a lactose intolerance, and the staff agreed to let the child stay. And it's difficult to argue against parents, but especially in an outbreak, you really want to be strict on it. But if they've got diarrhea or vomiting, they need to go home. And if it's a lactose intolerance, to say, but try not to give them lactose so this doesn't happen. Again, they didn't have a good reporting system, so lots of multiple systems, phone calls, emails, text messages, and not documented in one place. It's not too bad when you've got 1 or 2 cases, but when you've got, I spoke to a school only a week and a half ago and they had 70 cases. So actually, if it's not documented in one place, and we phone up and say, oh, can you give us the information? I think it took them a day to put it all together, and that's not the hassle you want where you've got children vomiting everywhere. So as soon as you get that case, make a template, put it on there, and then it's done. Not asking the right questions. So it's, what's the illness? What are the symptoms? How long have they been off? Have they attended any parties? If Mohammed had a birthday on Saturday and he was in 2A, did a few children from the nursery go? Because actually, if all those children went, then it might be easier for us to identify a source. Do they have any siblings in other classes? And actually, if they do have siblings in other classes, do those siblings go to other schools and has that had diarrhea and vomiting? Because that could have come over. A key one, alcohol gels being used instead of hot water and soap. With COVID, it's all about alcohol gel, but actually for D&B, you really need hot water and soap because alcohol gel will do nothing. So next steps, once we've gone through a risk assessment, we'll go through IPC advice, which Maha's already gone through. So effective hand washing, protective equipment, 48 hours, exclusion, deep cleaning, so cleaning the area, not just the space, high touch points, go through the cleaning product recommendations. If a child's got possible E. coli, they'll need clearance sampling, which I'll speak about in a moment, and discuss about a possible EHO visit, depending on the situation. So sampling wise, so in this situation, child X had an initial sample, which is how we got told about them, but sometimes that can take a while to get through to us. And they needed, if they've got E. coli or possible E. coli, they need 2 samples before they return to nursery, and they're 24 hours apart. So if they mention E. coli or anything, ask about clearance samples. There's occasionally an exception, but we'll discuss it with you. Other sampling, we're likely to ask the nursery, you guys to do sampling, and we did for this nursery. And it's just to check what the illness is, because if it's Norovirus and it just happens to be an E. coli case linked to a school, it's not as serious. I mean, it's still not great, but it's not as serious because Norovirus does spread around. So the EHOs, environmental health officers, they work with the local authority. They help out with the sampling, and they're really good at that. And if they come round and visit, it's not because you're in trouble or doing a bad job. Sometimes if it's a complicated outbreak or ongoing, or if there's lots of people ill, it's quite good to get their input because they can go to you and ask, you can ask any questions a lot easier and do a risk assessment with you. They send out pots. We can also send out pots if we need to. It's a bit more complicated just because a lot of us are working remotely right now, but we can do that. If it's a large outbreak or being ongoing or people are seriously ill or hospitalized, we will be doing samples. Communication. So this is quite a big thing because I imagine you've got a lot of panic parents, especially if you start mentioning E. coli and hospitalizations. So in this instance, the nursery had already updated the parents and sent out an email to them. We've got a letter you can send out. So if there's panic about being handled, you can send it out and said, we've spoken to UK HSA. And if it's more serious, so if it is E. coli, we didn't for this situation because we got the samples back from the children and they had norovirus, not E. coli. We would do a letter specifically for that. So send out an initial one. And if we're like, actually, we really think it is, we would send another warning letter out. And if there's anything more serious, we can support you with the communication. So if children are hospitalized or somebody passes away, we can help you communicate that with the parents. We have our own communication team who supports us. So challenges for you guys, parents letting their children come into nursery unwell, that's just being really strict like you were with COVID, not waiting 48 hours post symptoms. Again, just be really strict and try and drill it into the parents because as soon as that comes in again and they're still unwell and spread it, the whole thing starts again. That's what you don't want. Hospitalizations in this case, there weren't any. Record keeping, it's just straight away, as I said, get that record going, who's off sick, when, what symptoms, any events, when they come back. Unsure on communications. So parents really speaking with each other, anxiety in the community, especially if E. coli is mentioned, or there's just lots of cases which are ongoing. Just tackle that straight away, send a letter out, or if you need support, we can give you a letter. It's fine and say we've spoken to them. Cleaning. So in this case, they didn't have correct cleaning products. So that can be a challenge. So as Maha said, just get those products in all ready to go and you've got them if you do have an outbreak. So the big risks not notifying us because we won't know about it and we can't give you advice. I mean, after this, you guys will all be pros in it, so it should be fine. But we can help you and try and intervene quickly rather than 9-10 days later when it's already hit 24 plus children. Not doing right IPC measures, we'll send a checklist out of that so you'll know. But we can also phone up because if you can't split classes up, we can give you advice on that and what else you could do to stop the mixing because it's not a one-way fits all because all your nurseries are different. Children staying in school unwell, that's really key. It's just if they're unwell, not to come in. Top tips, notify us if you have people who are linked. Anyone seriously ill or hospitalized, get in touch. If it's two children sat next to each other, and this is for any infectious disease, if two children are hospitalized, seriously ill, in the same class or next to us, if you've got any concerns, just give us a bell. No question's a silly question. This is what we're here for. Be prepared, have that line list ready to go, so that case list of who's off, who's not. Correct cleaning products in stock. Clean a whole area, not just where they've been sick. Look at our information, there's loads of stuff in there. We'll send an email out with some links and there's good exclusion criteria list as well, which tells you other diseases like chickenpox and things like that, how long they need to stay off for. Keep reminding parents about a 48-hour rule and be really strict on it. And as I said, just get in touch with us if you're unsure. This is our job, is to give information and advice. So don't feel like you've got nobody to turn to if you've got a question. We're happy to help. And that is it. So if there's any questions, then
yeah, thank you. Thank you very much, Maria, and thank you, Maha, as well for those presentations. Yeah, there was a question in the chat. Obviously, Maria's already been through that, but we will be sending out the slides and various bits of information as well. But yeah, just want to use the last 15 minutes really for any questions you have. Obviously, you've got Maha and Maria in the room now. So if you do have a question, either pop it in the chat or you can raise your hand using the emojis in the chat, and I'll come to you and unmute yourself and you can ask that question directly to either Maha or Maria. So yeah, does anybody have any questions to kick us off at all? Just wait in case somebody's typing out in the chat, maybe. Are we all experts now?
Were we so good?
Stunned silence. We'll the email we send out will have the links and some documents and also our contact number. So if you do have multiple cases, then you know who to contact, because sometimes it can be a bit tricky to find. But yes, we're North East, North Central London Health Protection Team, which is under UK HSA, which was Public Health England, just to complicate things.
Excellent. So we haven't had anybody put their hand up at all. Oh, yes, we have. Okay, Nav, was that on purpose, or that's your hand's quickly gone down there?
Sorry, that was me. I joined a little bit late, but I did see, I came in just as I saw on a slide something about 72 hours. Was that, I know that the exclusion period is 48 hours, which, to be honest, I've had parents knocking down my door for because they don't believe me. But what was that about 72 hours?
That was me, Nav. So
Yeah.
what I was saying that the setting would need to discuss the end of an outbreak. So a definition is basically an agreed definition is that you count the last 48 hours from the last case.
Yeah.
Because
Okay.
sometimes this would not be as clear like this. So you would just count it 72 hours after the initial onset of the last case.
Okay.
Yeah, I think it is a bit confusing, but usually end of an outbreak has to be discussed with us.
Okay. All
Yes.
right. Okay, that makes sense.
Yeah.
Thank you.
So it is very important to
Yeah.
as mentioned, Maria, to keep your line list as child's name and date of onset and when they were sent to home. So we will be able to have that as a reference to decide, okay, now this is the last child who had the diarrhea, for example, on the 12th, and
Yeah.
now this is we are on the 14th or the 15th. Okay, now no further cases. That's the end of your outbreak, and you can basically feel free to bring the your contractor to do a deep cleaning.
Okay. Yeah. Okay. So we'll have a look at that. And then you said that you have sample letters, and that's on your website, is it? Or
Maria, do you want to answer that?
I mean, I can do. So when we get in touch and do a risk assessment, we always email that risk assessment across, and we'll send a template letter that says we'll be in touch. We've spoken to UK HSA and they recommend this.
Okay.
And then if something more serious has happened, we'll adapt those letters as well. So it would be a kind of template for diarrhea, like gastroenteritis, norovirus type thing. But if something else has happened, like E. coli or Huss, as Maha was saying, we'll adapt it to be sent out to parents.
Okay. I have one more question. Is that okay?
Yeah, go for it.
Okay. So do we have to wait for 2 occasions from the same child before we send that child home? Or if, is there, because I'd like some sort of backup on that, because what I've been doing is we can tell it's a diarrhea, we need to send the child home. But the parents are like, oh, well, other nurseries wait for 3 bouts of diarrhea before they send their child home. And I'm thinking, who does that? Because you know your child and you know a diarrhea is a diarrhea, so we're sending them home. And I've had parents argue with me, well, they haven't vomited, it's only diarrhea and things like that, which is pretty outrageous, actually, when you know that there's But do you find that most nurseries are doing that with sort of 1 bout of diarrhea, 1 bout of vomiting, they're sent home?
Exactly. I think you've seen a lot of nodding happening, or no. Yes, immediately the child is put in an isolated room, supported, so it's not punished, kind of. It's just not to scare the child, and he's there until he's picked by one of his parents. Definitely.
Okay, that's good to know.
Very strict. You have to be very strict, as we mentioned, and I mentioned the STEC here, because what if it is an STEC? It's just you don't want to put the risk, not only the children, the staff at risk. So yeah, it's very important to be very strict about this.
Okay, thank you.
Good question. Thank you now.
Yeah, thank you very much, Nav, for your questions there. Really useful. We've got 10 minutes left. Has anybody else got a question at all? If not, I think we can call it to a close. Oh, yeah, we've got.
There is another hand.
Is that Eve there? Have you got your hand
Yeah,
up there, Eve?
it's not a question, just more so around the fact that I don't know if all of the providers on the call here know that the local authority on our hub page, which is the page for education providers, we have actually produced a document in partnership with Public Health around your statutory policy for controlling or for dealing with ill and infectious children. So if you haven't seen that already, it's a policy prompt document. It's not written for you. It asks you a series of questions that you'd need to consider when writing your policy. But what I might do, Ed, following this is ask you to liaise with us just to make sure that any of the bits you covered in this are included and updated on that policy prompt document. But as I say, it has been fairly recently updated by a public health nurse as a result of COVID. But if you haven't already used it, please do. That's what we produce these documents for, so that you have those robust processes in place to go to when you're not sure what you need to do.
Yeah, sounds like a good idea, Eve, and more than happy to do that. And as well, obviously, Maha and Marie, if you want to send you know, the slides and stuff to me, I can send those out or whatever. Okay, we've got a question in the chat. So Manira has asked, will we get a certificate for our CPD? Is that in relation to the checklist that Eve was just mentioning there, Manira?
I think she's referring to the attendance of the training. She's a
Okay.
childminder, so it's a certificate we issue if you attend the training. Manira, you would get that.
Perfect. Thanks, Temi. Yeah, so you will get that. Perfect. Again, any further questions as we're on here?
If there's no further question, I just want to say something again. I'm just repeating myself here. It is very important that you have a plan. Don't wait until you have an outbreak and then you run around. You will feel that you are less productive. You as a staff would be you know, a little bit scared, I would say. Just make sure that you have a plan in place and clarity, and also provide training to the person who you would ask to clear this spillage, because you would have a contractor, but you wouldn't leave the incident there until somebody comes. You know, it is better to clear it. So we need to you know, you need to train your staff in how to do this, and they get confidence, and also make the what you can call a spillage kit somewhere clear to everyone, that, you know, all the staff are aware that what is in that box, it's X, X, and X, and yeah. So that's what I wanted to say. I just wanted to say also that us as UK public I forgot what we call it, so UK Health Security Agency, because it's Public Health England was more appropriate for the tongue. We do not actually give a certificate for as such, but we can send an email. I hope Ed would be able to send an email. Thank you for attending, and these are the guidance and this would be an acknowledgement that you have attended the session. What about that?
Yeah, I mean, that sounds good. I think Temi said that, you know, they will be receiving a certificate, some sort of certificate anyway.
Okay.
If that's good. I just want to come to Samina, because you've had your hand up for a little while there.
Thank you. Just a quick question. Before, when we had any outbreaks, it was Waltham Forest that we were informing, and then obviously Public Health England and DfE and everybody. Is that still the same, or are we just informing yourselves now?
Samina, I'm not sure I understand. What do you mean? So if you have the cases.
Yeah. So if we had a case, we'd tell our Waltham Forest early years, and then obviously Public Health England and DfE. Are we still doing it that way, or are we just telling yourselves now?
Yeah, we are Public Health England, so yes,
Yeah.
you're doing it right. Yes.
So that is right. Okay.
Yeah.
So we are.
As I said, yeah, they just complicated our name now. Yeah,
Right, that's
Public
fine.
Health. Yeah, we are Public Health England. Yes,
Okay.
we are your local health protection team. So we're a group of consultants and practitioners that we work to support community settings to manage outbreaks of all sorts.
And once we've told you, early years would find out anyway.
Not really. You have to
Oh, we
inform
have to
them.
tell them as well.
Usually, but it is better. We will definitely we will check with our public health director at this case and say make sure. But I think it's a good practice to also let them
Tell
know.
them, yeah, that's how it was. Yeah, that's fine. Thank you.
Yeah, Samina, can I just come in there? I think the safest thing to do is continue to do what you have done, which is to contact the local Waltham Forest Public Health team. They will always let me know anyway, and then obviously contact this team as well. But the local Waltham Forest Public Health team will always liaise with us. You don't have to contact all three, just the two. That will be perfect because you've been doing that for COVID, etc., haven't you? So just continue to do that, and we'll just make sure we make the links and square the circle if you like. Yeah.
Okay, brilliant.
If in doubt, just CC everyone in if you email, and then you've covered all bases.
And then I just want to come to Nav, who's just put in the chat again. So just to be clear, we only need to report to Republic Health ? Do you have a reporting form? That's probably for either Maha or Maria there.
Usually we are emailed that you can email us or call. There is a switchboard that will take your call and make it an inquiry, and then we call you back for an assessment.
Very good. I hope that answers your question, Nav. Let me just flick back to see if anybody else has got their hand up here. Got an incredibly slow computer today.
You've got Kirsty, Edward.
Oh yeah,
Yes.
for some reason I can't see that. So yeah, go on, Kirsty, shoot.
I just wanted to ask, when you're saying about having 2 cases linked by time and place, how long is the time? Is it 2 cases on one day, or 2 cases within a week, or 2 cases 10 days apart?
Yeah, that's a good question, actually, Kirsty, because the nature of the diseases will be different. So if you talk about 2 cases of vomiting and diarrhea, the time will really be limited. And because norovirus, as we mentioned, is very contagious. So we're talking about very limited time. So 2 children in the same class is a time. So if one became ill and the second became ill the second day, and then you have a third one, a sibling in another class, and then they are pretty much the time is different. The time will be different for something that is not as infectious. So yes, the time is very limited. You have vomiting and diarrhea usually in hours and days, not a week or so.
Thank you very much, Maha. There we go. Perfect. I think we've finally come to one of our questions, some really good ones in there. So I just wanted to again thank you all for coming, and obviously thanks to Maha and Miri as well, who delivered a really interesting presentation. Again, we'll say again that we'll send all the stuff out, including the sort of slides and other information linked in Maha and Maria's presentation. And again, if there are any further questions, I guess they can they come to you, Maha and Maria? Is that something that settings can do if they have further questions about anything?
Yeah, sure. I am ready for any further. Yeah, and please let us know if these sessions are important and to you, if there's any areas that you think you need to know more. Myself and Maria, we are assigned to Waltham Forest community settings to support. So please use our help, definitely.
Excellent. Well, thank you very much, everyone, and have a lovely rest of your afternoon.
Great. Thank you very much, everyone. Bye.
Thanks.
Thank you.
Bye all.
Bye.